Staff Nurse Questions and Answers Part 1. In this video, we are discussing a few important NCLEX styles MCQs that may be asked in upcoming staff nurse exams. Welcome everyone to our YouTube channel for nurses preparation. My name is Neeraj Kumar Kathal. Let's move to the topic. Question number 1. As a nurse, you are monitoring a client in immediate postpartum period. You are checking TPR and BP every 15 minutes for first hour. Which value suggests you there is an excessive blood loss? Options are options A, increased pulse rate 90 to 102. Option B, an increased respiratory rate 18 to 22. Option C, temperature 100.2 degree Fahrenheit. Option D, none of the above. Right answer is option A, increased pulse rate 90 to 102. Rationale. An increased pulse rate is the first sign of excessive blood loss. It is because heart pumps faster to compensate for reduced blood volume. A slight increase in temperature is normal. 18 to 22 respiration rate is normal. Next question number 2. I am sorry, there is a numbering mistake. It is question number 2. That is, as a postpartum nurse, you are providing instructions to mother of newborn. The newborn is suffering with hyperbilirubinemia. In following, which is your most appropriate instruction? Option A, stop breastfeeding and start bottle feeding. Option B, breastfeed the newborn less frequently. Option C, continue to breastfeed every 2 to 4 hours. Option D, none of the above. Staff nurses, here's the rationale. Hyperbilirubinemia is an elevated serum bilirubin level. Elevated level of bilirubin causes jaundice. If jaundice occurs in the first day of life, it is known as pathological jaundice. In this condition, we are advising to give frequent breastfeeding to the newborn every 2 to 4 hours. Less frequent breastfeeding or stopping breastfeeding or starting bottle feeding is not recommended. Question number 3. You are having a fluid volume deficit patient. Treatment given to this patient to resolve the fluid volume deficit condition. As a nurse, how you will determine that child condition is improving? Option A, urine specific gravity is 1.030. Option B, urine output is less than 1 ml per kg per hour. Option C, capillary refill time less than 2 seconds. Option D, none of the above. Option C is the right answer, capillary refill time less than 2 seconds. Rationale. Urine specific gravity 1.030 and urine output less than 1 ml per kg per hour, showing that condition is not improving. Capillary refill time less than 2 seconds shows that fluid volume deficit condition is improving. Next question number 4. A child is admitted in the hospital with a diagnosis of pyloric stenosis. As a nurse, you know which is the main clinical manifestation of pyloric stenosis. Options are A, large amount of bile in vomit. B, projectile vomiting. C, watery diarrhea. D. None of the above. Option B is the right answer, projectile vomiting. Pyloric stenosis is a disease condition in which passage between the stomach and small intestine become narrower. Clinical manifestations of pyloric stenosis are projectile vomiting, irritability, constipation, etc. Guys, listen, do you like this concept of question and answers? If you like this concept and want more MCQs with rational, then please like this video and comment your suggestion, experience, etc. It really helps me to get an idea that you are liking this concept or not. Next question number 5. A child with rubeola, means measles, is admitted to hospital. Which type of precaution is necessary for this patient? Options are A. Neutropenic, B. Airborne, C. Protective, D. None of the above. Option B is the right answer. Airborne precaution is necessary. Rational. Rubeola means measles. It is transmitted via airborne particles or direct contact with infectious droplets. So airborne droplet precaution required, and person in contact with the child patient should wear mask. Staff nurses, you must keep this patient in private room. Question number 6. As a staff nurse, you are carrying a patient with psoriasis. Salicylic acid is prescribed to the patient. Which finding indicate that presence of systemic toxicity from this medication? Option A. Respiration decreased. Option B. Tinnitus. Option C. Constipation. Option D. Diarrhea. Option B. Tinnitus is a right answer. Tinnitus means ringing in the ears, hearing of sound when no external sound is present. Salicylic acid is absorbed readily through the skin and toxicity can result. Toxicity symptoms include tinnitus, dizziness, hyperapnea, and psychological disturbances. Next question. An autoclave is used to sterilize hospital supplies because A. More articles can be sterilized at a time. Option B. Steam causes less damage to the materials. Option C. A lower temperature can be obtained. Option D. Pressurized steam penetrates the supplies better. Option D is the right answer. Pressurized steam penetrates the supply better. An autoclave, an apparatus that sterilizes equipment by means of high temperature pressurized steam, is used because it can destroy all forms of microorganisms including spores.